Good morning, everybody. We're going to start off with some announcements. We're going to do the fun announcements first. So it's Breast Cancer Awareness Month. So I just think it would be fun. Thursday, I'll be coming in my pink to Zoom class. If you have pink and you want to support breast cancer awareness, please join me in that. If you don't, it is not a requirement, but again, it's just a way for us to kind of show some solidarity for the cause. Second thing is Halloween is coming up. It's on a Friday, I believe. Yes, it's Friday the 29th. We don't do Zooms on the 29th. So on the 28th, our Zoom, if you want to dress up, we're going to have a Halloween costume contest. So of course, you guys, we see each other like from the chest up. So it's not like you have to do anything elaborate, but yes, I will be coming in a Halloween costume. Just again, something that's for fun. And you know, it's just how often as adults do we dress up for Halloween? I don't. I may be using the same costume that I used last year. I don't know. But it's just a time to have fun. And if in between now and then you want to wear spooky shirts, or, you know, I went to Walmart earlier and I bought a gray shirt that said boo. So I'm always thinking, what will I wear around the house again? You know, or if I have to run to the grocery store or whatever, and I have that on. So I don't want to, I'm usually too frugal to buy something that I can't wear. Hi, Melissa. Welcome.
Hey.
Good morning.
Good morning.
We're just doing announcements. We're talking about it's Breast Cancer Awareness Month. So starting Thursday, if you want to come dressed in your pink for to support, that's fine. You guys know you can pretty much wear anything that's appropriate anyway, but and that we're going to have a Halloween costume contest on the 28th. And again, we only see each other from here up. So again, it's not required. It's just something fun we can do. And I would love to be able to take a snapshot of you guys dressed up and be able to put it on Facebook on our we have a Unitech online page. We have our own private page that we use, which some of us use, and we don't use it a lot, but we have one that's directly related to the school. So there's that. Okay, so now is our announcements about assignments. I'm having a lot of trouble with some understanding what I'm asking for, because you guys know that you're doing sim charts, right? Sim charting. And sometimes I'll say, do sim charting 41 through 31. Now, I'm not saying that's what you're doing today. I just picked numbers. And then on the actual assignment, it says in red, submit completed in sim charting in order to get a grade. That means in Ginzabar, you have to actually submit those words. You can put it in a document and save it. You can take a picture of it and save it, and then put that where I'm asking for it. The reason being, I'm going to give the reason so everybody can understand why I'm doing things this way, is because sim charting does not transfer over to Ginzabar. I can't just click a button and all of what you've done go into Ginzabar. That's the first thing. Second thing is, if you have 10 sim charting in a day and I have 67 students, that's 670 sim charting in that one day. It's too many for me to go through and say, okay, Julie did this and Melanie did this and Kelly, you understand what I mean? I do go in and look at different things. It's random, but there's absolutely no way I can look at 670 sim charts. So I thought that was an easy way to meet in the middle. I can go in and see if you've been in sim charting. Some of you have, not you, but some students, not specifically you guys, some have not even done one assignment and their name isn't showing up in sim charting. There's absolutely no reason for this. We're on day what? We're on day 8. This is a 20-day module. You get behind the last day of this module at midnight, I'm shutting this module down. There will not be any more time because there's absolutely no reason. If you're having an issue, please contact me and we'll work on it together. But on day 19, don't contact me and ask for extensions. It's not going to happen this time. There's absolutely no reason. There's no hurricane right now. It just has to be done. Y'all let me check to see if maybe a student's trying to get on and they're texting me. It was, Kenyana was having internet issues and she wanted to know if she could dial in. So if there's a way to dial into Zoom, I don't know. But anyway, so just read when you get in and you see your assignments and you read what I'm asking for. Don't try to decode it. Just give me exactly what I'm asking for. If I say submit completed in sim charting, to me, that's obvious. I'm only asking you to submit in sim charting because it does not come over to Jenzabar what you do in sim charting. I have to go in and look. Does that make sense? Am I speaking in a way that makes sense? Okay. All right. I did something a little different. So I want to show you guys real quick. In Jenzabar, you're going to be able to see there's a new little tab on the side. Oh, I gave an example. Submit completed in SimChart to receive your grade. Do you guys recognize that? If you just copy and paste completed in SimChart and put it in a document or take a picture of it and upload it, that's all that I'm asking for. All right, so that was that. Okay, so over here on your gray tab bar, you have your textbook. You have your SimChart for the medical office where you launch your SimChart, and underneath is going to be Zoom classes. Here I've already loaded laws and ethics lecture. So this is where I'm going to begin to put our Zoom classes. Very, very easy and laid out Zoom classes, and they'll be listed here with the date. Make sense? Easy. So that way I don't have to go in and put the classes under day 8 of 20 daily assignment. You know what I mean? I just thought, okay, let's simplify that a little bit. There's so many of us now that's to me, that's not an easy way to do things. So the next thing that I want to, I'm just going to go through something real quick. Most of you know this, but your textbook is here and some extra information. Your textbook is going to give you step-by-step instructions to what you're going to do for your SimChart for the medical office. To get in SimChart for the medical office, you click SimChart for the medical office, you launch. If it does not come up, then your pop-up blocker is on. Okay, so I think that's probably the millionth time I've shown that, but I just want to make sure everybody is aware of that. Any questions before we move on?
Yeah, where you launched a SIM chart, I noticed that I have the same thing where it says ITT certified.
Yeah, that's for the IT department to get in.
Oh.
Yeah, I accidentally clicked that earlier and it was like, you're not supposed to be here. So it's like, oh, no, that's for IT to be able to get in and make any changes that they need to make on their end. So that's what that's for. Okay, so today for Zoom, we're actually going to do what we were supposed to do last Thursday. We're going to do Ncct prep for law and ethics. Do you guys remember that you watched that lecture already and you kind of went through the packet, right? So today we're actually going to go through those questions together. And even though you've already answered it, I want to go through it again as a class together. And because when I tell you this is so important, this is so important. It's going to be all over your Ncct. It's going to be there. So this is just one of many lectures we're going to be doing on Ncct prep. But I'm going to be bringing you through a site. It's called ncctinc.com, ncctinc.com. Okay. What is this? This is the actual certification exam site. On this site, you can purchase the study material or the study thing that I'm fixing to show you. It's an interactive review is what it's called. I don't remember how much it is. It's on there. So when you get on and you start looking, it is an extra expense for you. But what I'm telling you, instead of having these paper documents that you have to constantly copy and all of that, it's a great thing to do to get ready for certification. You're going to be able to take 2 certifications, an administrative medical assistant certification and a medical insurance and coding certification. I've only ever had one student do the front office or the AMA certification. But almost all of my students do the billing and coding. It's provided with your curriculum to do both. So if you want to do both, then I would really, really recommend you do both, because what do the certifications do? It's like a diploma. It's like, look, I'm certified in front office. Oh, look, I'm certified in insurance and coding. It can do nothing but help you. And it's already provided for you in your school fees. There are 2 packets available on Ncct, and one is the front office and one is the coding and insurance. The coding and insurance is more expensive than the other one. But again, if you're going to take those certification exams, it's an expense that I think is important. So without putting it off any further, I'm going to share my screen and we're going to go through it. Come on, move out of the way. So this is what it looks like, and I am in mine. We're going into the interactive review, and I'm talking to y'all like you're going to be getting into this yourself. You will if you purchase it. So this is what you're actually getting if you purchase it. Success strategies, patient safety goals, detailed test plan, sample example items, terminology, abbreviations. There's a preliminary quiz, an interactive review, case scenarios, and this is an actual mock-up exam. But what we're going to be doing together is an interactive review. And then when you click interactive review, see all of these review packets? This is where the packets that I have y'all practice on, this is where they came from. I copied and pasted everything. So I'm going to go ahead and click into laws and ethics, and this is what it looks like. I'm going to see if I can't get it to go back. We're going to start on number 3 because that's where we are. You guys are welcome to write your answers down or say your answers out loud after I read, but give everybody a chance to get the question before you answer. So number 3 says, which of the following is an example of a Stark law violation? A physician using self-referral, unbundling procedures, asking for payment from a minor, or a physician receiving kickbacks?
Is it A?
Yes, the answer is A. Now I'm going to turn my screen around again so I can talk to you about the Stark law. Anytime that you see anything that says self-referral or reference, that is the Stark law. Anytime you see something that says, I'm trying to think, I used to have a friend, they own a bicycle shop. And every time he went to the doctor, he traded services. He would fix his bike and he would get the doctor's visit for free. That is an anti-kickback law. That was breaking the anti-kickback law. So anytime that you can take something that's monetary, Saints tickets, a gift card to your favorite restaurant, anytime the monetary, if they're switching, that's anti-kickback. So let's go back and we're going to look again. Okay, so we think a physician using self-referral. Let's see if our answer is right. That answer is correct. So let's move to our next question. A specialist gives a general practitioner concert tickets every time he refers a patient to him. This is illegal according to Kelly Cassidy. What is it?
D.
D? Yeah. Everybody agree?
Yes.
It's right. See, it may be silly when I'm talking to you about it, but when you start thinking about it in that way and you see the questions, they make sense, right? So that's why we're going to talk about it and we're going to talk through it. All right. so let's go to the next one. During an annual audit, it is discovered that the office coding staff have upcoded procedures. Which of the following law applies? Anti-kickback, Stark, HIPAA, or False Claim Acts? Okay,
D.
so somebody said D.
Yes, ma'am.
D is correct. Let's stop and think about it. If we're upcoding and we're putting those codes on our CMS 1500 form, claim form, so start thinking about, okay, when we code something, where does it go? Goes on a claim to be sent to the insurance company, right? So that should click in our head, false claims. Okay, so here we go. So let's see. Yep, False Claims Act. Which of the following laws pertain to an insurance and coding specialist who knowingly presents an incorrect CMS 1500 for payment to a payer?
A.
So we have the Federal Civil False Claims Act. So do we agree that it's a false claim? Let's try. That's right, because a CMS form is a claim form. Which of the following regulates healthcare billing for services that are not medically necessary? Stark Law, Patient's Bill of Rights, Health Insurance Portability and Accountability Act, Federal False Claims Act.
D.
Who thinks it's Federal False Claims Act? Well, let's see. It is. Let's look at the question again. Okay. Whenever you go back to the previous question, it brings you back one more. Let's take a look at it. Are we supposed to do things that are not medically necessary?
No.
We're not. So when we start charging for things just because we want to, or, oh, if we charge for this and this and this and this, and the doctor's saying, oh, I'm going to do this and this and this and this, going to a cardiologist, but he decides he wants to do a brain scan. You understand what I mean? He can charge for whatever he wants to, but if it's not medically necessary, then it's against the law. You can't just do stuff because you want to. Now, if he can prove that he needs to do these things because of whatever diagnosis, or having severe headaches, so that would be a reason to do an MRI, right, on the head. But if he's having right pain toe, is there a reason to do an MRI on the head? I know that sounds silly, but that's what we're talking about. Has to be medically necessary. Sometimes I hear people talking about that Medicare, they just do this and this and this and this, and there ain't no reason for it. Kind of listen in the waiting rooms when you hear people talking. They can't do it unless it's medically necessary. They have to prove why they want to do it. The diagnosis has to meet the need for the CPT codes. So it always makes me smile, because people really don't understand, right? They don't understand. Yes, there is a reason we're doing this. You may not think there's a reason, but there actually has to be a reason for it to be legal. All right, so here we go. So our next question. Which of the following regulation prohibits a physician from referring a patient to a facility in which the physician holds a financial interest? Okay, nobody answered. This one's for Julie. Speaking of referrals, the Stark Law? Let's see. Yep, that's right. See, there's that word again, referring, referral. Great job. Okay. A local laboratory sent a physician 2 tickets to a football game as a thank you for referring patients to the testing center, to its testing center. Which of the following has been violated? What do you think, Kedra?
B.
Let's see. It is B. It's B because it's football tickets, right?
Yes.
A lawyer has called and demanded information about a patient in the office. The insurance and coding specialist can share the information if she calls the patient and obtains permission. The lawyer tells her he has permission from the patient. The lawyer provides his identification number, or the patient has signed an authorization form.
D.
I don't know who said D. Who said D? Don't be shy. Does everybody agree? Is it D? Hello?
I think it's D.
D? In order for us to release any information, what do we have to have?
Authorization.
Authorization from the patient. Have to have an authorization for release. So I don't know who said D, but that's right. I had to look through to see who, y'all, I have to write names down to remember when I start reading. I'm like, okay, who's on this? Who's on the call? Who's on the call? Okay, Melanie, the next one's going to be yours. The High-Tech Act was created to promote the use of, I'm going to remind you, I don't know if y'all remember. Do you remember me saying anytime that you see high tech, you're going to see something about meaningful use? Do y'all remember when I told you that now? Do you?
Yes.
This is the reason why I told you that. Okay, so I gave you a little hint there, Mel, just to remind y'all. Okay, so the High-Tech Act was created to promote the use of which one, Melanie?
C.
Mm-hmm.
For some reason, I had put down B in the past, but I'm thinking it's C now that you mentioned meaningful use.
It is C because it's meaningful use. Okay, next question. Okay, now one of the things I'm going to actually flip around and tell y'all. I don't know if you have a place where you can make notes or you can go back and listen to this again. Anytime you see a question that gives you 3 answers, it is for sure going to be on your Ncct. For sure. So these that have 3 answers, we make sure that you remember them. Anytime coding, whatever it is, claims, whatever we're going through, if it has 3 answers, it's definitely on the Ncct test, or it used to be. I know that they've changed them a little bit, but just to be sure, we're going to make sure that we know them. Okay, so let me turn back around. Okay, which of the following meets the definition of a covered entity that must comply with HIPAA? Do you guys remember when we talked about, or we read about covered entities? So let's see. There's clearinghouses. What is a clearinghouse? Well, whenever you send your claims out, you transfer them at the end of the day after billing. They go to a clearinghouse to be sorted. Employer, pharmacies, nursing home facility, and the patient. So if we're not sure about the answer, let's do process of elimination. Is an employer a reason for to be a covered entity for a claim?
No.
Oh.
No. Which other would not be really someone who needs to have access to a claim?
The patient.
Okay, so by process of elimination, we've brought out employer and the patient. So that leaves us with clearinghouse, pharmacies, and nursing home facilities. Does it make sense to why these would be covered entities? They're going to have restricted information, aren't they?
Yeah.
Clearinghouses are going to have restricted information because they have the claims. They have the insurance information. Pharmacies, again, they have insurance information. Nursing homes, again, has all of those, all the information that the pharmacy is going to have. Date of birth, social security number, policy numbers, what they're being treated for. So let's see if we're right. I have a feeling we are. We're right. Okay, which of the following does the Fair Debt Collection Practice Act allow when contacting a guarantor about an outstanding bill? Okay, how many of you have ever been contacted by a bill collector? It's just something that happens, right? It's something that happens. I'm going to tell you something. The last time I was contacted by a bill collector, it was for a medical bill, but it was only because it was in the insurance hadn't paid. I'd met my deductible and we were still trying to line all of that. Sometimes that takes time. He called me at 6 o'clock on a Saturday and he was very ugly to me. But what he didn't know is I knew the law. And when I told him, you're not allowed to speak to me this way, it's against the law. Oh, he got mad. Got real mad. And I told him, I said, guess what I also know? I also know that I can tell you, do not call my number again, and they have to comply. And he didn't call me again. The claim was paid. There was no issue. But if you know what the law is for debt collection, not only will it help you in the job, if you have to call a patient about an outstanding bill, don't call them before 8 o'clock in the morning, and don't call them after 5, and don't call them at work, and don't leave it on the answering machine. Stop and think about it. It's almost like, how would you want to be treated, and what would be the way that you would want your information provided to you? You wouldn't want, I mean, you know, what if your best friend lives with you and they're checking your messages and you haven't paid you don't want them to know that, right? So you don't want to leave that on someone else's answering machine. Calling an employer. If I owed a bill, I wouldn't want someone to call my boss at Unitech and say, hey, do you know Marcia Gallagher? She hadn't paid her bill. See what I'm talking about? So some of these things are going to be natural to say, you know, that doesn't make sense. Miss Roblin, this one's going to be yours. Which of the following does the Fair Debt Collection Practice Act allow when contacting a guarantor about an outstanding balance or bill? Sending a postcard confirmation of the agreement, contact the guarantor's employer regarding wage garnishment, leave a detailed message on the guarantor's voicemail regarding the debt, call the guarantor to remind him of the balance due. Now, I think, well, looking at them, I thought, well, maybe A, send a postcard confirmation of the agreement, but that's not appropriate either because anybody can get the mail, right?
Yeah, because that's private. You're not supposed to share that information.
That's private information. That's protected health information.
And if you leave a message, somebody else
Right.
will get it.
So I say probably D, huh?
Well, look at B, contact the guarantor's employer. Well, that's definitely right. So
No, you're not
that's
supposed to do that.
definitely not right. So by process of elimination, let's do D.
That's what I say.
That's right. That's
Yeah.
absolutely right. Okay. Which of the following requires that a medical practice informs the patient in advance interest will be charged on delinquent accounts? Okay, let's talk about each of these. We've talked about Stark Law. That has nothing to do with the Stark Law. Truth in Lending Act, Fair Debt Collection Practices Act, and Omnibus Act. So
I think it's B.
okay, Melissa, can you tell us why you think it's B?
Because they're telling you about the interest that's going to be charged on that account. I guess it's kind of like a finance charge.
That's exactly right. When someone lends you money, do they lend you money free of charge?
No.
No. There's always an interest rate, and they have to tell you what that is, right? So anything to do with an interest rate is a Truth in Lending Act. That's right. So 15, The insurance and coding specialist called the patient at 7:30 a.m. to discuss an outstanding balance. Now, you guys don't answer this, my angel. This is going to be yours. Which of the following acts did the specialist violate? Truth in lending, fair debt collection practices, fair credit billing, or equal credit opportunity? Now look at the time at 7:30.
B.
So B, my angel says B. Let's try. That is absolutely right. Number 16, which of the following laws requires full written disclosure about the finance charges for large payment plans involving 4 or more installments, excluding a down payment? I'm just going to let y'all start answering so we can get through this a little bit quicker. What do we think? We have finance charges.
B.
So B, truth in lending. That's right. The insurance and coding specialist arrives at work at 6 a.m. One of the duties today is to follow up on patient delinquent accounts. The specialist knows that calls cannot start for the accounts until 8 a.m. due to the
Fair debt collection.
Which of the following should the insurance and coding specialist do first when she suspects illegal practices under the Federal Civil False Claims Act? Okay, we're going to talk a little bit about these because this can be a hairy situation. If you're working for a facility and they're committing fraud, don't you think that's a little bit of a hairy situation? How many of these cases have I heard of? None. Will you have to deal with that? Probably not. But we want to talk about it to prepare in case, right? That's one of those things because, you know, I'd be calling saying, what do I do about this? Miss Marsha. And then we'd have to look it up. But let's talk about each of these scenarios real quick. Continue to bill the claims and look for another job immediately. That might be our first go-to, right? Correct the claim codes and submit the claims to OIG once updated. OIG stands for Office of Inspector General. C, make copies of the claims to use as evidence and contact the insurance carrier. Or D, stop billing the claims and contact the facility's compliance officer. Which one of those makes the most professional sense?
D.
D, stop billing the claims and contact the facility's compliance officer. Now, if you're working in a small clinic, that's going to be your office manager. You know, if you're working in a huge hospital in Houston, you're going to have a compliance officer. That person's going to be different. So I kind of just wanted to tell you that when you're working in a small facility, you're not necessarily going to have a compliance officer, but you do need to let someone know in charge that this is what's happening. It could just be an accident, right? So we want to make sure that we're not accusatory. We just need to make sure that we are compliant with the law and then we handle it professionally. It can be a tightrope. So let's put our answer in and see. Yep, that's correct. 19, one of the following collection activities is prohibited by the Fair Debt Collection Practices Act. Calling the debtor during normal business hours, calling relatives to inquire about the debtor's contact information, providing the name of the creditor to whom the debt is owned, contact debtor by mail.
It's going to be calling relatives.
Right. We can't call Johnny's mama and tell him he owes $5,000, can we? Especially if Johnny's 26. We can call during normal business hours. We can provide the name of the creditor to whom the debt is owed, and we can contact the debtor by mail if it's a sealed envelope. A while ago, it was like on a postcard, right? This is private, it's sealed. Okay, this is a 3 again. The insurance and coding specialist is training a new employee on collection procedures. Which of the following should she tell the new employee? Select 3 correct answers. You may leave a message on the patient's place of at the patient's place of employment. Yes or no?
No.
No.
You must identify yourself and the reason for your call.
Yes.
Yes.
You may call between 8 a.m. and 9 p.m.
Yes. I think so. Yeah.
Okay, let's try. You may call during the work week, but not on the weekend.
Yes.
You may not say they could be dismissed as a patient for the non-payment.
Nope.
That is definitely not something you can do.
Right.
So just by process of elimination, we have our 3. Uh-oh.
Oh, did I mess up?
You must identify yourself and the reason for your call. You may call between 8 a.m. and 9 p.m. and you may not say, oh, we misread.
We misread. What?
Hang on.
It's red.
You're marking which ones are correct, and that was the last one was correct.
Oh, that's
Yes,
what we did.
we misread.
Yeah, yeah.
Yay, we got it right. All right, that's good save, good save. Now listen, in your NCCT, you can't go back. Okay, if the insurance and coding specialist suspects major insurance fraud, which of the following should she report it to?
B.
Yeah, the Office of Inspector General.
Office of Inspector General. The physician that the insurance and coding specialist works for is fraudulently billing for services that were not provided. The specialist has previously tried to talk to him about it, but he continues with these practices. Which of the following should which one of these should you contact?
B.
B.
Okay. A patient calls the physician's office and indicates that the provider is a friend of a friend who referred her and wants the provider to waive the routine office visit copay of $30. Which of the following statements should the insurance and coding specialist use in response? We will waive the copay per the physician's instructions. Waiving the copay would violate the anti-kickback law. The practice attorney will review the situation and contact you. I will need approval from the manager.
Is B.
That happens all the time. As a coder for a cardiology clinic, do you think I was ever charged for going to the doctor there? No, but you don't make that decision. If the doctor comes to you and says, write this off, most of the time it's not going to happen though, guys. Do you think the doctor is going to charge his kid for coming to see him? We had a Mr. Dr. Brian. Do you think Mr. Dr. Brian charged us, family friend, babysat his kids? You know, it happens, but per the law, it's not supposed to happen. I just kind of want to add to that because you have to understand that some of these laws bend a little bit and some do not. Diane's going, yep, they do. She works in the medical field. So, all right. Which of the following are considered standard responsibilities for an insurance and coding specialist? And there are going to be 3. Complete the insurance claim accurately. Yes or no?
Yes.
Yes.
Waive co-payments and co-insurance as required for patients.
No.
No.
Transcribe medical records for the physician.
Nope.
No.
Submit claims to the third-party payer.
Yes.
Yes.
And apply credit and collection laws.
Yes.
Yes.
Makes sense, right?
Yes.
Are you a transcription person?
Nope.
No.
Is that in your scope of practice?
No.
No, it's not. Do you feel like you're transcribing their handwriting sometimes? Yes, you do. Which of the following are exceptions to the confidentiality requirement under HIPAA? Select 3. Okay, you're just going to have to remember these. So let's kind of just talk about it. Child abuse,
Yes.
Yes.
gunshot wound,
Yes.
Yes.
And abortion.
overdose,
No,
No.
tuberculosis,
no.
No.
abortion. That leaves abortion.
Yes.
That is right. Please remember these. Which of the following actions will help to protect an insurance and coding specialist from being charged with fraudulent behavior? So we're going to say yes or no. Follow current billing and coding practices.
Yes.
Report only the codes that the provider selects. Okay, we don't know. Let's skip
No.
down. Ask for clarification when documentation does not support coding.
Yes.
Yeah.
Abstract data from the patient's EHR summary page.
Yes.
Yes. I would say yeah.
Fill out the CMS 1500 completely. I think the word here they're looking at completely, you never fill out every line of a 1500 form. So let's-
Oh. Okay.
A clinical laboratory receives orders from a physician for a specific clinical laboratory test. The lab performs and bills for the test indicated on the order, but also bills for additional tests that were not ordered or rendered. This illegal practice is considered
Coding? Is it?
Fraud. Fraud.
Oh, it's fraud.
yeah, it is fraud, but I'm gonna talk about coding.
Okay.
I'm gonna be transparent, Melissa.
Okay. It kind of sounds like it too, though. I mean,
Right, but the reason it's not up, go ahead, Melanie.
Well, this is what I had posted on Facebook about, because this is where like fraud and like the words they felt similar to me. And
Yes.
Yeah.
Okay, well, the reason that it's not upcoding is because let's talk about an E&M code. Let's say that you were only in for 20 minutes and it should be a 99212. But he wants to get paid $50 more, so he codes a 99214. We upped that code to get more money.
money.
That's what upcoding is.
Okay.
When you just blatantly charge for something you didn't do, it's fraud. So that's kind of how I had to really stop and think about it. I was like, why did I get that wrong? Why is it that? And I really I was like, okay, now I understand. Now I had to think that out.
Yeah.
So don't feel bad, because when I was reviewing this packet myself, I was like, oh, darn, I got one wrong. I'm gonna have to tell them I got that wrong. An intentional tort in which unconsented, harmful, or unwarranted physical contact occurs is an example of
Battery. Right?
Yes.
Yes.
I know we want to say abuse, don't we? Battery is unwanted physical contact. Malpractice is illegal professional treatment. Abuse is the misuse of something such as alcohol or power. Negligence is a failure to provide proper care. Okay, a physician does not require his patients to pay copays. The insurance and coding specialist has told the physician this is an illegal practice. The physician continues to waive the copays. Which of the following indicates the appropriate course of action for the insurance and coding specialist? Ignore the situation because the physician owns the practice. Alert the insurance carriers. Add the copay amount to the patient's bills. Send written notices to the patients.
B.
Or
Y'all think B? Let's see. That is right. Some states may be stricter than others when it comes to the practice of waiving copays, and some may have harsher penalties, but it is still a poor practice and not accepted by insurance carriers. If a physician is participating in unacceptable practices against an insurance carrier, that insurance carrier should be notified. I would talk to the office manager or your compliance officer first. Because if you contact that insurance carrier, you better be on your way out the door. Just saying. Makes sense though, right? Which of the following are legitimate reasons for a provider to terminate a patient relationship? There's going to be 3. So we're going to say yes or no. A, patient consistently fails to keep appointments.
Yes.
Yes.
Patient fails to make payment arrangements on a delinquent account.
Yes.
Yes.
Patient is related to a staff member.
Yes.
No.
So we think C is a yes or a no?
Yes, it is.
No.
No,
No?
No.
no.
Okay, which of the following legitimate reasons for?
It's gonna, D is gonna be the next one.
Okay,
Patient
I'm
is a
just trying to,
Yeah, we'll talk about it a little bit. Patient
Okay.
is non-compliant with medical treatment.
Yes.
Yes.
yeah, I think that's one.
Patient is disruptive in the waiting room.
No.
Okay, so let's talk about,
Okay,
so Diane works in a medical facility. Say that she works for Dr. Hart. And her great grandmother is an established patient.
mm-hmm,
Just because she's kin to that person doesn't mean that she can't be seen in the clinic.
okay,
So I understand how you would think that would be a conflict of interest. Like if you're a surgeon and your wife is in an accident, that's a different thing.
Yeah.
That's a conflict of interest that is way too close to home, but we're just talking about in general practice.
okay.
Which of the following activities is an example of abuse rather than fraud? Upcoding, misrepresenting the diagnosis, inadvertent coding errors, billing for services not rendered.
D.
B.
I'm sorry, somebody said B?
D.
Somebody
Mhm.
said D?
That's
Okay, so abuse can be inadvertent. Fraud is blatant. It's inadvertent coding errors. Abuse is an unintentional mistake. Okay, I need for you to stop and just put on your coding hat, your medical coding hat. Whenever someone abuses their kid, that's intentional, right? But that's not the type of abuse we're talking about. We're talking about an inadvertent error. When you're dealing with coding, if you have inadvertently coded something, it's abuse, but it's not, abuse is a heavy word for us, right? So you have to kind of expand your brain a little bit in just this capacity. We're not talking about someone abusing power or someone abusing their dog or someone abusing their kid. We're talking about an inadvertent act. And in this instance, it's called abuse. I know I have trouble. Don't feel bad if you have trouble with the word abuse in these circumstances. I do too, because when we hear abuse, that is just huge for us. But we're not talking about abuse in its regular form, what we're used to hearing it. We're just talking about in the billing and coding realm. Okay, we have one more to do. Which of the following legislation prohibits physicians from referring patients to an entity if the physician or a member of her immediate family has a financial relationship with the entity?
D.
It says referring, right? So Stark Law, and that's right. Okay, did this help anybody?
Yes.
I kind of feel like when we go through it together and we really talk about it and we just kind of break down some of these words, to me, it gives, even for me, it gives me a better understanding. Because
It
by the
does.
time we get back around to studying it again, I need to study it again and refresh my memory. So do you guys have any questions?
Mm.
No?
Ma'am?
All right, well, get to your sim charting. Who's liking the sim charting? I mean, I know some people hate it, some people love it.
It's okay. I mean, I usually just print out the paper, whatever my assignment is, I just print it out and I have a stack and I just go through it. But the only thing that's not working on mine is the text, like whenever you hit the text box and you go to True Code, it
Yeah,
doesn't automatic generate. So I just have to type it in myself.
right.
But I could paste it. That's fine. I could do the paste and copy thing, but I just can't. It won't go in there.
Right. Well, True Code will, like Kelly said, it hasn't been working for her, and then all of a sudden it's working this morning. It's when you get to an office and they use True Code, at least you're going to know where it is, and then you just
Yeah.
click which one you want. I think it's just important to know that. I wish that it worked for us just like that, but unfortunately, it doesn't. It doesn't always. But I hope that you're learning a lot. I know it gets monotonous, especially when you're like, why are you telling me to click this and click that? I know to do that. Well, because you start at ground zero and you build up and up and up, you know. So, and also I want to tell you guys something. If you go to YouTube and you click in, or you put in sim charting for Ella Rainwater, somebody will go through that step by step with you. If you're having one that's giving you trouble, if you can't find the name, just click on it and do exactly what you're asking for. There's so many resources out there. Don't just say, I don't understand, and quit and stop. Don't do that. When you're working in a medical facility, guess what? You got to figure it out. Critical thinking, go out and research. Part of being a great coder is researching. Even billers have to research and look and hunt and learn to understand things. Someone's not going to be there to tell you everything just like that. So it's okay for you to go out and research and Google it and look. I absolutely encourage you to do so. All right, anything else, ladies?
No, ma'am.
Okay, well, I will see you at 11 o'clock on Thursday. I think we're gonna review for the test on Friday. And I don't know what else we'll do. We'll figure something else. But on Thursday night will be ICD-10 coding at 7. So we'll
Okay.
do a couple of more classes of ICD-10 coding. And I want to remind everybody, remember your Zoom class is going to be loaded under Zoom class on your gray tab.
Thank
Great
you.
class, everybody. I enjoyed it. Have a good day.
You too. Bye-bye, y'all.